Welcome to Mom's Heart Talk Show. As usual, your favorite and very educative talk show where we give you the insights on motherhood and the journey that it comes with it. Today, we have another episode on your way, and we have another interesting topic as we always bring on your way to discuss. We have an expert also guest with us to do that honor for us. Most of the time, women go through pregnancy, labor, and delivery without complications. However, some women experience unpleasant complications that ranging from mild to the severe and even maternal or fetal mortality. Most women are aware of these signs, but just ignore it. Expectant mothers are expected to know these signs and then work towards it to prevent complications or death. Today, our topic for discussion is danger signs in pregnancy, which is very key in pregnancy as we journey through it. We have a guest with us who is a physician assistant in the person of Madam Comfort Ayu, to do this honor with us, to explain to us the danger signs. What are they? What we should know about it? What it entails when we are faced with one? What should we do? First aid. What should we do with the social support that we have in our homes? And then when you get to the facility, what should be done for us to reduce maternal and fetal mortality? But the host, Mom's Heart Talk Show. Mom's Heart Talk Show is proudly brought to you by Mom's Heart Foundation. You can follow us on our social media handles and www.momsheartfoundation.org, where we have mother care products you can buy online and it will be delivered to you in your homes. The funds that comes out of this is used for our outreach programs, is used to support mothers out there, our vulnerable children out there. So support us with our numbers on the screen. You can call us to support the show and support Mom's Heart Foundation. Our today's topic is danger signs in pregnancy. And as I initially mentioned, we have a special guest with us, a physician assistant in the person of Madam Comfort Ayu. Madam, please, you are welcome.
Thank you, Madam.
To Mom's Heart Talk Show. Comfort, when we talk about danger signs of pregnancy, what is it about?
Okay, thank you. And then I want to say hello to your cherished listeners. Now, when we say danger signs of pregnancy, we mean the signs and symptoms that can endanger the pregnant woman and then the baby. So when we talk about the signs, we are talking about what the pregnant woman sees on her body that can endanger the pregnancy and then herself. When we talk about the symptoms, we talk about how the woman feels that can endanger herself and then the pregnancy. So talking about signs and symptoms of pregnancy, we say the things that the pregnant woman sees on herself or the feeling that she has that can threaten or that can endanger the pregnancy and then the pregnant woman herself.
Okay. It means that the pregnant woman rather will feel the danger or will know the danger first before any other else.
So when the pregnant woman knows what the danger signs are, there are some of them that she will feel it in her body. She will communicate it out and then we are able to help. Yes.
Okay. So now we've come to that stage. Because there are a lot of signs and symptoms that comes with pregnancy. So how will I know that this is a danger sign, this is not a danger sign? For instance, nausea, vomiting, everybody knows it's normal with every pregnancy. So how will I identify that this is a danger sign, this is not a danger sign?
Okay, so for danger signs of pregnancy, when we talk about some of the danger signs of pregnancy, nausea and vomiting, like you said, is a danger sign. That is when the pregnant woman vomits and then has vomit excessively. Okay, so when you are vomiting, we know that you are bringing out fluid from your body, and there should be a replacement. So when you are vomiting excessively, you become weak and tired, and it can endanger the fetus inside and then you. So that is one of them. We can have bleeding in pregnancy. That is a danger sign of pregnancy. So we can have convulsion where the pregnant woman fits. So when the pregnant
So it's
woman
not
is having
children
a
that will
seizure,
convulse.
no, pregnant women also convulse in pregnancy, especially for those with hypertension in pregnancy. It can have seizures, which can lead to eclampsia.
Sometimes we'll be able to know that the vomiting, when it's excessive, maybe 3 or 4 times, you have to rush to the hospital. For convulsing, you see that your feet are swollen with high BP or a known hypertensive, you have to rush to the hospital. When it comes to preeclampsia, which is another life-threatening condition, what are the signs?
So for preeclampsia, when you attend regular visits, anytime you get to the ANC, they do some labs to find out, to pick it up early. So maybe you might not have any signs and symptoms, but when you come and then we check your vitals, we know that your BPs are high. We check your urine, we see there are proteins in your urine. Yes, we make the diagnosis, put you on medications, and then we start from there. But you don't wait till you have the symptoms, oh, I feel headache or this, before I rush to the hospital. That is why we have regular antenatal visits. When you come and then there are complications that may arise, we pick it up early before it can cause any
results in
danger.
that. Okay. What about the blood vision?
So with the blood visions, when your BPs are high, it can also cause that. So you don't wait for you to be having blood visions before you come to the hospital.
So that's at the end of
yes.
it.
So when we detect it very early, then we prevent. But when you know that you have hypertension and then you are spoken to come to the hospital, you have to be in the hospital for this number of days before your day of delivery, and you still stay at home, that is when you may have those complications and then come. And when you don't come early for us to intervene, you may have results that will end up in dangerous complications that will later affect you even after delivery.
Okay. The reason that for our viewers is a sad story I heard about a pregnant woman who was vomiting, and neighbors said it's normal. Pregnant women will vomit, it's normal, and the lady vomited a whole day, and before they rushed her to the hospital, she lost her life and then the unborn child. Just excessive vomiting. So we may think that it's some things that happens in pregnancy is normal. It's not normal. It may be normal with 1 or 2, but you know when it's becoming too much of it, because you are losing fluids. And whilst you are vomiting, you can't be taking water. It will even go. And then so the person...
So as you are losing fluids, you are losing electrolytes.
Yes.
So you have to come for it.
So she became weak, that she couldn't even talk. That's when they noticed that, no, we have to take her to the hospital. And sadly, it was too late. And there are deaths that I always say, it's preventable. You can't just sit down for vomiting to just kill you like that. So we should be aware of the signs. We know the signs. It happens to us. But we just overlook things and then things happen. So that's why I'm stressing on the signs. What and what we should know. Then we rush to the hospital. We are very grateful. So if I know the sign now, I know that if I see 1 or 2 things, no, I have to rush to the hospital. What can I do before maybe I can get to the hospital? What I've identified it, what can I do? Oh, this pregnant woman who was having this excessive vomiting, what should it have been done for the person before rushing the person to the hospital.
Okay, for a case like this, in pregnant women, we don't tolerate delay because some delays may lead to maternal and maternal deaths.
Yes.
So what we encourage is that you speak to a relative or a friend who can accompany you to the health facility, so that when you come to the health facility, timely intervention saves life.
Okay.
So when you get there on time, we are able to save you and then the fetus.
Okay. All right. So in pregnancy, we know we have trimesters in pregnancy. We have the first, second, and third. At what stages in the pregnancy that you likely to see these danger signs?
Okay, so in pregnancy, you are likely to see these danger signs in all the 3 trimesters.
Okay,
First,
I thought there
second,
is a
and
stage
third.
that.
No, all 3 trimesters. So in the first trimester, when you are bleeding in pregnancy, it could be a miscarriage. You are having a lower abdominal pain, it could be an ectopic. You are having a fever, it could be an infection, it could be malaria, and then urinary tract infection.
Okay.
So in that stage, you can also have danger signs. In the second stage of pregnancy, after 20 weeks, you can have you can still have abdominal pain or no abdominal pain. You can be bleeding, dizziness and all that. You can have preeclampsia and eclampsia. And then in the third stage too, you can have complications in pregnancies too. So in all the stages of pregnancy, you should note them. These are the signs and symptoms that when I experience is a danger sign. So there is no specific like this third trimester, this is when I should look for the signs and symptoms in pregnancy. No.
So it runs
through all the stages in pregnancy.
Okay. But are there particular danger signs that you know that this one it's particularly pertains to this trimester?
Yes, there are danger signs that pertains to this trimester, but it's not specific. So I always encourage my clients that when you see something abnormal, just come to the hospital. Yes, and then we take it up from there.
Okay. Okay. The signs.
Okay.
And then the trimesters. If, for instance, as I was saying, the morning signs is still repeating itself at the last stage, what should I do?
So the best advice we will give is to seek a healthcare professional's advice, because at home there is nothing you can do at home. So you come to the hospital. If you need medications, fine, we give you medication. If it is counseling, we will give you, fine, we give you counseling. And even if there is something we should teach you to do at home, we teach you and then you continue at home. But to take the knowledge into your hands and be doing your own thing before you get there, like I said earlier, prompt intervention saves lives. For us to give you the prompt interventions, unless you come to our end. Yes. So when you stay for long in the house and then it wasn't before you come, sometimes you may end up in serious health conditions that even after delivery you would have to live with it. So the best thing is to report at a health facility where the healthcare professionals will continue from there.
But do you have clients that normally don't come for ANC?
Yes, there are clients who do not come for ANC, especially with the primates and then with those who have had several pregnancies. So because they feel they have delivered before, they've been pregnant before, they know themselves and they stay at home and then until the day of delivery before they come to the hospital. And then with those who have not delivered before, the first time is they follow the elderly, they say do it this way, and they don't present to the hospital until it is too late. Yes.
But when they come to the hospital, do they get the knowledge enough to be able for them to take care of themselves whilst they are away from the facility?
Sure. The midwives take them through and they teach them. So when they come for antenatal, they check their vitals, if they do some labs from time of gestation to delivery. There are some labs you should do so that we pick up danger signs very early, so that we don't complicate health problems. So they do all that, and then they have teaching sections where they teach the pregnant women.
I heard of
Ah,
pregnancy
yes.
school.
Yes,
So
pregnancy.
is there a school
There
they
is-
graduate from?
Yes, it's a school they
How
graduate
do they
from.
enroll it?
So what? So far as you're pregnant, you enroll in that. You
What's
just come for
the school
antenatal.
fees? How much is the school?
It's free.
Oh,
just
really?
just come for antenatal.
So
school.
you just need to be pregnant to be
Pregnant
part of that
to be
school.
part of the school. And then you present there. They take you through the school.
Is it at every facility or?
It's at
peculiar
every
place?
facility.
Oh, okay.
They take you through the process, and then when there are complications, they detect early. They refer to the doctors, and then we take it up from there.
So do you think this pregnancy school is it really helping?
It's very helpful because when they come, some people don't really know their bodies. So when they come and then they tell you that when you see this sign, you see this sign, you see this sign, it means that this is it. So they are able to pick it up early and then present, because somebody can be there, she doesn't know her body, so she feels it's normal. Like you said, vomiting in pregnancy, the person was vomiting, and then they kept telling her it was normal. It was normal. She was vomiting until the time that she was almost dying before presenting to the hospital.
Yes.
That caused her to die. Yes, that caused a mortality. But if you come to the pregnancy school, you are taken through those processes. Even there, you ask your questions and then you are answered. You are clear about those. That will help the healthcare worker and then yourself from the complications in pregnancy.
In your submissions, you were looking at the trend of it. You are always talking about early detection. But if the pregnant woman doesn't present itself early enough, you can also not detect it early. So what is causing the delay?
So I would say some of the things causing the delay are ignorance, and then peer pressure. So with
Peer pressure?
Yes. With some pregnant women, they seek advice from their friends. Yes. So when my friend tells me, "Oh, this is like your story," she was seeking advice from the people around. So with that one, she will be reluctant to present at the hospital because her friends are giving her some advice. So some of them also. Your question again.
So that I want us to talk about the delay in seeking health behavior.
Okay.
You know, we have some 3 delay health seeking behaviors, which is common in our jurisdiction as the attitudinal behavior, like and self-medicating.
Sure.
Especially in pregnancy is very crucial not to self-medicate. Yes, but most of the time they do. And because of, as you were saying, peer pressure, this one knows, this one, when I was, because I know I met a certain pregnant woman, very humorous, like when she comes to the ANC and she's being given medications, she goes home and shares it with her other pregnant friends of other pregnant women. Or when I went, I was given tablet A, B, C, D. Do you have some with you? Because the other pregnant one goes to another facility.
Okay. So
Okay, then let me give you my own. Then you too, what was given to you, she takes it. And she's always presenting with complications. You don't know where it's coming from. So not knowing, she's taking other people's medications, thinking that if she combines medications from this facility, she's having a holistic health.
Even that alone, some also resort to herbal medications. Yes. So they take this herbal medication. Oh, this one gives blood. This one does this, and then they self-medicate.
Makes the baby skin nice, and so they kind of delay.
And then some of the delays can also be transport to the health facility. So when you know that you are pregnant, I think that you should prepare towards that. During this stage, I would be visiting the hospital more frequently. So a means of transport, you can prepare a means of transport, or the facility can have midwives on call. Maybe I have this and you can't rush there early. You can call the sister and then she will come to see you. Yes.
So every pregnant woman should have their midwives.
Yes. Contact. So we link them up to specific midwives. Oh, sister this, sister that. So you know your sister. Anytime you come, she will see you throughout the pregnancy, because it's a holistic care. So she will have to see you throughout the pregnancy. So if you have any problem, you can pick a phone and then call
them. Yes. But don't be calling in the midnight. That's
why
you people don't answer our calls. We call at any time.
Sure.
Hey,
But when
Madam,
you are
are
a
you
person,
sure? Madam
too,
Comfort, are you sure?
I'm very sure. If you're a person, you see, when we stop answering your calls, it means that you keep calling with conditions that maybe you can come to the hospital and then we will see you.
Yes.
So you are a habitual caller who calls and then your complaints are
My
not
head,
really
today my
necessary.
nose,
You
today
get it, yes. But if it is somebody who we know, okay, I am the one who seeing you throughout your pregnancy,
Yes.
and I know that it's a high risk pregnancy, and then you call me at midnight, I know there is something happening, so I cannot avoid your call. But if you are somebody who calls, oh madam, my head, my leg, and then it's not really a high risk pregnancy, it's difficult to answer those calls. Yes.
So we have high risk pregnancies.
Yes, we have high risk pregnancies.
Are there people those that no baby, no home?
Yes, those are ones.
So they
one
are
of them
kept at the facility during their pregnancy.
Yes. So somebody losing amniotic fluid throughout her pregnancy, you don't want her moving around up and down at home, working up and down. So you keep her in bed till delivery.
So all these are the
Signs of pregnancy.
Okay.
We have more. We can go and then mention more and more, but because of our time, we would have to.
Maybe you have to do part 2.
Sure.
Of the danger signs, because there is a lot I also want us to talk about, but I don't want us to rush through. I want viewers to know the signs that they see before they come to the hospital, so that they won't delay or take it as one of those signs that is seen in pregnancy.
Okay, I can just mention a few.
Okay.
You can have fever where you feel warm, your temperature is very high, bleeding in pregnancy, bleeding per vagina, I mean.
But when you are pregnant, not to cut you, when you are pregnant, your temperature is normally high. Or
so you have your body temperature, but when you see it's extremely high, you see I'm here, I'm warm.
Okay.
You get it? Okay. But my temperature can rise up. So when I see or I feel I'm high, my temperature is high. Okay, I present to the hospital. Sometimes they come, oh, me why? You get it? You've been warm for some time, but that temperature you see is abnormal. Yes, so you can, because it can be an infection, and then malaria can also terminate pregnancies. Yes, so you have to present. When you are bleeding in pregnancy, you have to present to the hospital. When you are feeling dizzy, headache,
but some also women may be having their menstrual cycle whilst pregnant.
No,
is it normal?
It's not normal having your menstrual.
It's different from the bleeding.
Bleeding, yes. So I've told you, even if you are bleeding and then you think it's your menstrual cycle and you are pregnant, you still have to present to the hospital.
Because it's not normal.
Yes, it's not normal, so that we see how we go about it.
But will it end? Because I know a woman who was, I think 5 months or 6 months into the pregnancy, she was still seeing her menses.
Okay, so you are seeing your menses 5 months into pregnancy. You can't be at home and say it's my menses. You have to present for the doctor to tell you that, oh, this is your menses, this is not your menses. So when you come to the hospital and we tell you, oh, go and come this day, oh, do this for us, then you know that this, you are specific that this is it. Okay, but you are bleeding in pregnancy and then you are at home. You get it? So if it's a danger sign of pregnancy, you've not presented to the hospital. It's something that you are having a danger sign, but you don't know. Please, do you get it? That is advisable that when you see some of these things, you just walk to the hospital and then we take you through it. It's having severe lower abdominal pain in pregnancy. You have to present to the hospital. And then normal
because normally people complain, oh, Mrs. and I said
it's this Ghanaian perception that normally when the child is in the uterus enlarges. Sometimes it sits on the bladder. Okay, that's how come more often you have urinary tract infections and pregnancy. But even if Akolano Otna and then there is a complication, you have to present. Okay, maybe the Akola is sitting on your bladder and then you are having a urinary tract infection and you're in the house.
It's
just
but the womb is not in our system.
Yeah, no, the womb is not in our system. It's something that the elderly say. So when they come to the hospital, we take them.
The nurses in our homes.
the elderly women, yes, they take them to
We
it
call them the
because-
nurses in our
Oh,
home.
sure.
They have not been to any nursing
Nursing
school,
school,
but
but
they can give you the anatomy of the body.
Some of them are
Map.
very good, but some of them too along the line. So it's best you come to the hospital so that we detect it.
And what again?
So we have seizures, and then like convulsion in pregnancy, and then nausea and vomiting in pregnancy. You are feeling dizzy, palpitations, headache. It could be anemia in pregnancy. You don't know. Frequent urinating in pregnancy. Those
Is
are
it not normal?
No, frequent urinating in pregnancy is not normal.
Wow.
So you come to the hospital and then we take you through it.
Okay. You mentioned pregnancy-induced hypertension.
Sure.
Do we have pregnancy-induced diabetes?
Yes, we have pregnancy-induced diabetes when the patient is not a non-diabetic, but the sugars are high. That is how come it is important to visit the A&C so that they detect all these things before it leads to complications.
Okay.
Yes. So when they detect all these things, they will counsel you and take you through the best measure that will help you to keep you safe and then the future safe.
Wow. We really learned a lot, and we are about to wrap up with our show today. We want to find out our last question. If I have this danger sign, or I've seen this danger sign, I've been to the hospital early, there are things being done for me. Is there any follow-ups recommendations that you want the pregnant woman to do?
Sure. So like some follow-up recommendations I mentioned earlier. So we have a sister, let's say one midwife, taking care of you throughout the pregnancy. You have your contact. You can call her and then she comes over to see you, or she tells you do it this way, do it that way, and then you tell some relatives around you, these are my danger signs. So when it starts, they quickly bring you to the hospital. You arrange for some transport means. If the facility is far from where you are, then you come to the facility. And then when you come to the facility, and then we need to see a gynecologist or an obstetrician. We need to see an obstetrician, sorry. We take you to the obstetrician to do the follow-ups. Yes, so those are some of the follow-ups.
Financially too.
So financially,
it's a challenge.
It's really a challenge.
Because it's sad that some pregnant women die because of financial challenges.
So that's how come we have Moms Health Foundation,
Moms
Heart Foundation.
Yes.
They can also support, or we have hospital aids that they can also seek finances from to support. Family relatives can also help, and then we can take it up from there.
Thank you so much, Madam Comfort. And that is why you also have to plan. With previous episodes, we spoke about planning for pregnancy. We don't have any mistaken pregnancy where they are by mistake. No, we have to plan. And as Madam Comfort said, putting all this in place with your transportation, financial, even the human support system, social support, everything has to be planned before we get pregnant. But because most of our pregnancies are unplanned, all this comes to us and it just gets over us and we don't even know what to do. We are running helter-skelter, looking for this, looking for that, looking for that. And at the end of the day, if we are not fortunate, we end up ending our lives. Because most of the times, some women come to the facility and you see that there is no planning with this pregnancy. And in terms of financial burdens and other things, we can't even come in to help them. Thank you so much, Madam Comfort Ayu, who is a physician assistant that has helped us today with the dangers. We'll come with part 2 of the dangers because there is more to talk about. This is Mom's Heart Talk Show, where we always bring you an insightful and educative show. Follow us on all our social media handles. Mom's Heart Talk Show on YouTube, on Instagram, TikTok, everywhere. And also don't forget our website www.momsheartfoundation.org. Patronize our mother care product, especially with the diapers, so that we can have enough funds to support mothers who are financially derived as this, so that we don't lose these mothers. They are precious moms, thinking of a mother who is gone, leaving the baby. Who is going to take care of that baby? Or the baby is gone, the mother so hopeless, nothing to hold on to. Mom's Heart Foundation comes in to support these mothers, not even financially alone, but emotionally, everything. We support them. We also want you to sponsor this program and support Mom's Heart Foundation financially, or in any other ways you can support us with, so that we can reach a number of people and put smiles on people's faces. My name is Sheila Jukum Mofat, your host for today.
Mama.